Have you ever felt that uneasy, nervous feeling? We all have. But when does it go from normal to something more serious? Today, we're diving into the world of anxiety, what it is, why it happens, and how to deal with it. Let's explore together and figure out when it's time to ask for help. Many individuals experience occasional feelings of anxiety, a natural response to perceived threats or fear. However, when anxiety begins to disrupt daily activities, it may indicate the presence of abnormal anxiety, often associated with various anxiety disorders. Fortunately, effective treatments, including counseling and medication, are available for these conditions. What is anxiety? Anxiety arises as a natural reaction to fear or perceived threats, but it can escalate into a problem when excessive worry is directed towards relatively harmless situations, negatively impacting one's daily life. Is anxiety normal? While feelings of anxiety are a natural response in stressful situations and can be adaptive, they are considered normal. For instance, anxiety may arise when facing a threatening person or before a significant event, leading to the release of adrenaline and nerve impulses that facilitate a fight or flight response. Imagine this: you're about to give a speech in front of your classmates. Your heart races, your palms get sweaty, and you feel a bit shaky. That's normal anxiety, your body's way of getting ready for a challenge. But what if those feelings stick around even when you're just talking to a friend or doing something you enjoy? That's when anxiety might need a closer look. Anxiety becomes abnormal and may be classified as a mental health condition if it is disproportionate to the stressful situation. When the level of anxiety exceeds what is appropriate for a given stressor, persists beyond the stressful situation, if anxiety lingers even after the stressor has passed or when the stress is minimal, occurs without apparent reason, anxiety appearing without an identifiable cause or in the absence of a stressful situation may indicate an abnormal condition. Symptoms of anxiety. Feelings of fear and tension characterize anxiety, accompanied by various unpleasant mental and physical symptoms. Physical symptoms of anxiety: palpitations, sensation of a thumping heart, nausea, tremors, sweating, dry mouth, chest pain, headaches, rapid breathing, dizziness. These physical manifestations result from the brain transmitting numerous messages through nerves during anxious states. The release of stress hormones, including adrenaline, into the bloodstream further contributes to symptoms such as a racing heartbeat and sweaty palms. Mental symptoms of anxiety: fatigue, restlessness or irritability, difficulty concentrating or making decisions, sleep disturbances, excessive worrying about the past or anticipating negative future events. Behavioral symptoms of anxiety: desire for solitude and avoidance of social situations, selective mutism, where a child cannot speak in specific contexts, like school, development of compulsions to alleviate anxiety-inducing thoughts, for example, excessive hand-washing due to germ fears, potential development of agoraphobia, a fear of leaving one's home, adoption of unhealthy coping mechanisms such as alcohol misuse or substance abuse, which may temporarily alleviate symptoms but exacerbate anxiety in the long run. It's crucial to seek appropriate assistance and explore constructive coping strategies to manage and overcome the challenges posed by anxiety. Causes of anxiety. 1. Genetic predisposition. Some individuals may have a higher susceptibility to anxiety due to their genetic makeup, possibly involving a chemical imbalance in the brain that intensifies anxious feelings. 2. Past traumatic experiences. Difficult experiences during childhood, adolescence, or adulthood often act as common triggers for anxiety-related issues. 3. Current stressful events trauma. Ongoing stressful life events or recent trauma can serve as immediate triggers for anxiety symptoms. 4. Medication and substance-related factors. Anxiety may manifest as a side effect of certain medications, especially psychiatric drugs. Additionally, the use of recreational drugs or alcohol can contribute to heightened anxiety levels. 5. Underlying medical conditions. Anxiety can be symptomatic of other illnesses, particularly conditions like hyperthyroidism. Risk factors for anxiety. Females are more frequently affected by anxiety than males. A family history of anxiety, depression, or other psychiatric disorders increases the risk of developing anxiety. Childhood abuse or neglect, as well as parental mental health issues, contribute to the risk of anxiety. Being a victim of bullying during childhood is a recognized risk factor for anxiety. Experiencing sudden bereavement can elevate the risk of developing anxiety symptoms. Events such as separation, widowhood, or divorce are associated with an increased risk of anxiety. Unemployment is identified as a risk factor for anxiety. Substance dependence or exposure to organic solvents is linked to a higher likelihood of anxiety. Presence of chronic health conditions like heart disease, cancer, respiratory disease, diabetes, or arthritis can be associated with an increased risk of anxiety. Alcohol, recreational drugs, and anxiety. While alcohol may provide temporary relief by alleviating symptoms, it is important to note that drinking does not serve as a cure for social anxiety. Using alcohol as a means to calm nerves can contribute to problematic drinking habits and may exacerbate issues related to social anxiety and depression over the long term. If you find yourself relying on alcohol or street drugs to alleviate anxiety, it is crucial to seek professional help. Consult with a doctor to discuss your concerns and explore healthier coping strategies. Understanding anxiety disorders. Anxiety disorders are characterized by symptoms that disrupt normal daily activities or when persistent worry about developing anxiety symptoms significantly impacts one's life. Approximately 1 in 20 individuals are estimated to have an anxiety disorder at any given time. Various anxiety disorders exist, including social anxiety disorder, panic attack and panic disorder, generalized anxiety disorder, acute stress reaction, post-traumatic stress disorder, phobias, for example, agoraphobia and specific phobias, obsessive compulsive disorder, OCD. Additionally, there's an adjustment reaction, akin to an acute stress reaction, where symptoms arise days or weeks after a stressful event like a divorce or house move. Referred to as an adjustment reaction, it is characterized by symptoms similar to acute stress reactions, potentially including depression. Typically, these symptoms improve over a few weeks. Hold on, guys. Before we jump towards the treatment of anxiety, let me tell you a little story. It's like a magic trick that makes dealing with anxiety way easier than you might think. Ready for a story that might just make treating anxiety seem not so tough? Let's dive in. As days go by, Sarah notices these anxious feelings affecting her daily life. She starts avoiding social events and feels restless even when she's alone. It's like a cloud hanging over her, making everything seem harder. The once vibrant Sarah begins to feel a bit lost. But here's where the story takes a turn. Sarah decides it's time to talk to someone. It's a brave step, and she opens up to a friend who suggests seeking help from a counselor. With support, Sarah embarks on a journey of self-discovery. She learns about different coping strategies, discovers simple breathing exercises, and talks about her worries openly. What she realizes along the way is that it's okay to ask for help. It's not a sign of weakness, it's a sign of strength. Slowly, like the sun breaking through the clouds, Sarah starts feeling more like herself. The weight on her shoulders begins to lift, and she rediscovers the joy in simple moments. Now that we've seen how Sarah turned things around, let's talk about how you can do it too. Treatment for anxiety. The primary objective of anxiety treatment is to alleviate symptoms, enabling individuals to regain control over their day-to-day lives. The choice of treatment depends on the specific condition and the severity of its impact. Treatment options may include non-medication treatments. 1. Understanding. Recognizing the root cause of symptoms and discussing concerns with friends, family, or healthcare professionals can be beneficial. Some individuals may mistakenly attribute physical symptoms, such as a thumping heart, to a physical ailment, intensifying anxiety. Understanding the nature of an anxiety disorder may not cure symptoms, but often provides relief. 2. Counseling. Counseling, especially focusing on problem-solving skills, can be effective for certain conditions. For instance, it may aid individuals with generalized anxiety disorder, GAD. 3. Anxiety management courses. Courses that teach relaxation techniques, problem-solving skills, coping strategies, and offer group support can be valuable for specific conditions. 4. Cognitive behavioral therapy, CBT for anxiety. CBT, if accessible, is effective for persistent anxiety disorders and phobias. This type of therapy addresses current thought processes and behaviors, aiming to bring about positive changes to help manage anxiety. 5. Self-help. Various national groups offer information, advice, and support. Your doctor or practice nurse can connect you with local support groups for face-to-face assistance. Additionally, self-help resources such as leaflets, books, CDs, DVDs, and MP3s are available. These materials provide guidance on relaxation techniques, stress reduction, and simple deep breathing exercises, offering tools to manage and potentially alleviate anxiety symptoms. Medication for anxiety. Antidepressant medicines. Selective serotonin reuptake inhibitors, SSRIs, are commonly employed as anti-anxiety medications within the antidepressant category. SSRIs beneficial for anxiety include 1. Escitalopram. 2. Sertraline. While primarily used for depression, these SSRIs also prove effective in alleviating anxiety symptoms. They operate by impacting brain chemicals, specifically neurotransmitters like serotonin, which are implicated in the manifestation of anxiety symptoms. Other medications your doctor may consider to manage anxiety include mirtazapine, venlafaxine, paroxetine. Benzodiazepines. Historically, benzodiazepines like diazepam were commonly prescribed for anxiety treatment, known as minor tranquilizers. Despite their efficacy in short-term symptom relief, these medications have serious known side effects and are prone to addiction. Extended use beyond a few weeks may diminish their effectiveness, and they can induce drowsiness. Due to these drawbacks, benzodiazepines are now less frequently employed for persistent anxiety conditions. In specific cases, a brief course of up to 2 weeks might be considered for severe, short-term anxiety or sporadically to navigate through challenging periods with persistent anxiety symptoms. Beta blocker medicines. Certain physical symptoms of anxiety, such as trembling and palpitations, can be mitigated by beta blockers like propranolol. These medications primarily address the physical manifestations rather than the mental symptoms of anxiety. While beneficial for acute anxiety episodes, especially in situations like tests or exams where performance anxiety is common, beta blockers do not directly impact cognitive aspects of worry. In some instances, a combination of anxiety treatments, such as cognitive therapy and antidepressant medication, may yield better outcomes than either intervention alone. It's crucial to consult with healthcare professionals to determine the most suitable medication based on the nature and severity of the anxiety condition. Conclusion. Anxiety is like a common thread in the fabric of our minds. We all feel it differently, from everyday worries to bigger issues. Understanding it is the first step. Luckily, there are lots of ways to get help, like talking to someone or trying different treatments. Remember, you're not alone. It's okay to ask for help. It's a sign of strength. Let's break the idea that mental health is a taboo. By taking care of ourselves, we're making the world a kinder place. Your mental well-being is important, and you deserve support. And that's it, guys. We have covered a lot of useful information today. I hope that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.